Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Jacqueline Meredith. Today's episode is the third of an ongoing series addressing collaborations in care during the course of hepatitis B infection, featuring brief conversations between a physician and a patient. In this episode, Dr. Maria Buti has a discussion with her patient, Laura, who shares her experiences living with hepatitis B, highlighting opportunities to improve hepatitis B virus screening and transitions of care. Dr. Maria Buti is a professor of medicine at the Valle University Hospital in Barcelona, Spain. For the full online educational program, including medical minutes, downloadable slides, clinical thought commentaries, and other podcasts in the series, please visit the link in the show notes for this episode. And to get access to all of our new podcasts, subscribe to the CCO Infectious Disease Podcast on Apple Podcasts, Google Podcasts, or Spotify. Now let's get started.
Hi, Laura. Thank you for joining me today. How are you?
Hello, Dr. Buti. I am fine. And thank you for having me. How are you?
Not bad. I am visiting Laura for a long time. She attended my outpatient consultation, I think, for more than 10 years. Can you tell me, Laura, how you were first diagnosed with hepatitis B?
You know me. My history with hepatitis B is a bit particular. When I was born in 1977, my mother had an active hepatitis B virus infection. She was a lab technician in a clinical analysis lab, and she was pricked by a needle of a patient with hepatitis B. At that time, I was negative for the virus, and I was monitored until I was 5 years or more or less, with always negative results. Have I lived my entire life thinking I was negative until about 12 years ago? Yes, I have. I did not find out I had hepatitis B until I broke my finger on my left hand. My anesthetic told me that I should complete tests because I had problems with the blood coagulation parameters. So I did that, and that's when I tested positive for hepatitis B. I believe that vertical transmission of the hepatitis B virus is over 90%, but I could not rule the sexual route. I have had several stable couples for years, and I really don't know.
So, Laura, it seems that you have two potential risk factors for hepatitis B. One, the vertical transmission from your mother, and another one for sexual contact. So, prior to your diagnosis, were you open to sharing with other physicians your sexual history?
The only physician that has asked me about my sexual history was my gynecologist, who is not from the public health system, but a private mutual insurance company. She had been seeing me for more than 20 years. She always asked me about it and had no problems talking about this.
I am curious. Did any of your physicians recommend hepatitis B screening? And if not, why do you think this was the case?
Well, my gynecologist has done previous testing for sexual transmitted infection, but never hepatitis B test. I also had not been tested for hepatitis B through work or by my family doctor that is assigned to me in a public health system. In fact, my family doctor rarely performs routine tests on me. I think the reason for the lack of testing is due to money.
I think your personal story clearly shows the barriers to hepatitis B screening. Barriers sometimes that are related with every patient, but barriers sometimes also related to the physician. And I would like to ask you, why do you think patients fail to report risk factors to their physicians? Do you think this could be related with stigma associated with viral hepatitis?
I think there are many limitations to our public health system. The way it is set up, I don't think general practitioners can really get to know you well enough to inquire about risk factors for hepatitis B. Explaining the type of sexual life you have, I suppose, depends on the type of the person you are. In any case, I think that testing for sexual transmitted infection, among other tests, should be done routinely for everyone without having to ask about the type of sexual contacts you have. Even a person with only one or two sexual partners could get hepatitis B. On the other hand, I don't know if people in general really know a lot about hepatitis B virus and how it's transmitted.
You clearly has told me about sometimes it's very difficult that a patient recognize risk factors because they don't have enough data, enough education regarding viral hepatitis. But my question now is, have you ever experienced stigma related to your disease, related to hepatitis B?
No, I know this may not be common, but I have never had any problem with stigma related to my hepatitis B. I am very open with my hepatitis B diagnosis. As a pharmacist, I must explain my case without the stigma, without fear, and being aware that on some occasion, perhaps one of my acquaintances may have taken the test to find out if they were a carrier of the hepatitis B virus.
I am glad to hear you have not experienced any stigma related to viral hepatitis. I am not surprised because knowing you from the past few years, I know that you are a very open person and you are able to share your story with other people, but not everybody is like you. There are some patients that have stigma and they suffer a lot from the stigma. And I think this is another barrier for diagnosis hepatitis B. I would like to add that there are some barriers from the physician side. As I mentioned earlier, some physicians don't ask for hepatitis B, probably because they may perceive patients are at a lower risk for hepatitis B, and because of this, may not recommend testing or screening for hepatitis. I am happy to see that guidelines for screening are evolving. And one example of this are the new CDC recommendations to test all adults for hepatitis B without the need to report any risk factor. For me, this is extremely important. And this is different for other guidelines that still base testing on risk factors. Although our US guideline recommendations, this is something I am implementing into my practice. I am sure that others are also doing. My hope is that these recommendations will be adopted by other national and international guidelines. Now, let's ask me again about when we were first diagnosed. So after your diagnosis, can you share with me how you got roped into care?
Well, the Spanish health system has a very specific protocol, you know. The general practitioner must diagnose you with a positive hepatitis B test and then refers you a specialist. In my case, you, Dr. Buti. The overload of the Spanish health system delayed more, around 1 year, this visit to the specialist.
Yeah, 1 year, I think for the majority of patients, it's a long time. And during this year, you can suffer for your disease. So how were you feeling during this time? Do you remember a bit How were your feelings during this year of waiting for a visit?
I don't remember very well, but I think it was normal because I am a pharmacist. I know what is hepatitis B virus, and well, no, I spend the time with normal life. No, I don't have any problems about that. But I think that I am an exception.
Yeah, I think you are really an exception because many patients try to accelerate the visits, or even some of of them one day arrive to my outpatients consultation spontaneously. So there are different ways to wait, but perhaps you have some suggestions on how transitions of care can be improved among patients with hepatitis B.
I don't know, maybe you have the answer. I don't know how to improve this transition.
Yeah, I think there are several ways to improve this transition. One is with more education for primary care physicians, and they pay more attention to viral hepatitis and trying to accelerate the linkage to care, particularly to the specialist that at the end here in Spain is the physician that is able to prescribe the medication. Another way, I think it's patients associations. Patients organizations are always very useful for pushing and for advanced linkage to care. And finally, I think if there are some physicians at the community that can diagnose and treat hepatitis B, this will be useful. Up to now, hepatitis B is more complicated than hepatitis C. But if you are able to simplify diagnosis and monitoring, I am sure that some healthcare providers at community level can attend and can monitor patients with hepatitis B. So for me, these are my potential suggestions to accelerate and to improve linkage to care.
And let me say something. As a pharmacist and healthcare provider, I believe that the Spanish healthcare system had the potential to utilize their network of pharmacists who could contribute to detection with a rapid test, including a hepatitis B virus, hepatitis virus test, as is already done in other countries. No? But for me, as you said, prevention is essential. Explain the population what the hepatitis B virus is, the importance of vaccination, so that people are aware of the risk as well as getting tested if in doubt.
I agree. I completely agree with you, Laura, that the pharmacists can help in diagnosis, and I think it's a good place for a point of care testing, and this can be done for HIV. Why not for hepatitis B or for hepatitis C? I think this will be very useful for patients, and they don't need to report. They don't need to report risk factors. Can go to the pharmacy and be tested.
Yeah.
I have another point that I would like to mention, because hepatitis B, it's an infection that can be prevented. We have a vaccine. So for me, it's extremely important when you or somebody is diagnosed with hepatitis B, also talk about the relatives, about the partners, the family, on the possibility of a vaccination. And for the reason, all your relatives, your contacts need to be evaluated for hepatitis B markers to be sure if they have an active infection or a past infection. Tell me something about this, and if one of your physicians has discussed with you the importance of vaccination.
I suppose that you was the only one that recommend me to do that, but you test my relative, no? You tested my relative. You explained me very well how the hepatitis virus is transmitted and everything, and I think it was a very good job, and we did it very well, I think. And
I hope
they already vaccinated. Yeah, no, they already vaccinated with the vaccine. So
I hope I have done my job. I usually recommend testing all the partners, relatives for hepatitis B, and if they don't have previous infection or markers of hepatitis B infection, I recommend vaccination. Laura, thank you for sharing your story with us today. I would like to highlight some my major teaching points. Primarily opportunities that we as a healthcare professionals can better collaborate with our patients in improving their care. First of all, I want to highlight the importance of the screening. Screening for everybody, not only for those who report risk factors. And in this sense, I believe that CDC guidelines are clearly an advance. And second, I think as a healthcare providers, we have to work more on facilitate access and linkage to care, because screening without linkage to care for me doesn't make any sense. Thanks again, Laura.
Thank you very much to Dr. Buti and Laura, and thank you to our listeners for joining in. As a reminder to view the full Mind the Gap, Aligning Real-World Practice with Best Practice in HBV program on the Clinical Care Options website, click on the link in the show notes. And please be sure to check back for more episodes on important infectious disease topics. Thank you and have a great day.